Turning now to better health, not everyone's welcoming the summer heat, especially when it can bring health risks. Some of those who can be most vulnerable are pregnant women.
Tell me about it, right? Clearly. Joining us now is Dr. Megan Miller from Baystate Medical Center's Department of how do I say that? Obstetrics and Gynecology, to alert us on what we need to know. Megan, welcome.
Welcome.
Thank you.
So the heat has been pretty bad. Do you think that the humidity is playing a role in this as well for people?
For sure. I mean, the humidity makes everything seem hotter than it is, and it also just increases the risk of dehydration and makes it really hard to be outside.
We mentioned pregnant women, of course, but who else is most at risk?
So certainly the young and the very elderly. So older people are definitely in risk, and in the kind of in between ages, pregnant women are definitely higher risk.
Is there a certain stage in the pregnancy where you become more at risk when it comes to heat exhaustion, or hopefully not stroke?
Well, in general, pregnant women have kind of more blood flow going. So you ask any pregnant woman, and they feel hot pretty much all the time, even when they're in cool temperatures. So really, the heat can be difficult for any pregnant women, but it definitely becomes more difficult in the third trimester.
Sure does.
Yeah.
So what can we do? Help us.
So definitely you want to try to stay in a cool environment as much as possible. Staying in air conditioning if you can, especially when it's a major heat wave. Swimming is perfectly safe and can be helpful as well when it's super hot outside.
Who can actually swim in their third trimester? That's what I want to know.
Well, a nice float. I can imagine a float would be fun, right?
Some nice floats, absolutely. You just want to make sure when you're out of the pool that you're not out in the sun and getting sunburned and getting more dehydrated. You always want to stay hydrated. We recommend drinking tons of water as much as possible. I usually recommend that people drink at least 2 liters a day, and it might be more when it's this type of heat wave.
Really?
Yeah.
Wow. Wow. So I guess then, overall speaking, is there a time of year when this isn't a concern? Like, would it actually be the fall time when it comes? Like, is early spring a time as well? Because it can get hot then as well.
Yeah, absolutely. Anytime it's very hot outside can be a risk. And pregnant women are baseline at risk for dehydration, so we always recommend they stay really well hydrated.
What are some symptoms that they might get in response to heat-related issues?
Sure. So dehydration can cause lightheadedness, dizziness, fatigue, even contractions actually can occur with dehydration. It's usually not labor or anything like that, but it can certainly be uncomfortable and concerning to women, of course, especially in the third trimester. So we recommend lying down, drinking water, and resting. If it gets really severe, things like heat stroke and exhaustion can cause things like fainting, high heart rate, confusion. So you definitely want to let your healthcare provider know if something like that is happening.
Stay on top of it.
Yeah.
All right, good tips. Thank you.
Thank you.
Thank you very much, Megan.